Today on this episode of The Brain Surgeon's Take, we will be discussing Gray Matters, a biography of brain surgery with Professor of Neurosurgery at Weill Cornell Medicine, Dr. Ted Schwartz. Hear firsthand about the history of a profession that is barely 100 years old, yet uniformly captures our attention. How did early neurosurgeons come to understand the human brain? An extraordinarily complex organ that controls everything we do, and yet at only 3 pounds is so fragile. Much more on this podcast episode. Welcome back, everyone. Here's my take on Dr. Ted Schwartz. He is the perfect example of a physician thinking outside the box and pursuing goals other than just clinical medicine. I have known Ted for over 2 decades, as he has always been a role model and a mentor for me. I knew Ted was uber talented, but his latest endeavor of becoming a best-selling author with his newly released book, Gray Matters, is uniquely impressive. As a fellow neurosurgeon and colleague, I loved this interview and reading Gray Matters. This book gives the audience a first-hand perspective on how neurosurgery started, how it's progressed over the past century, and what it's like to perform brain surgery on a daily basis. I always tell our trainees that what we get to do as neurosurgeons is simply amazing. It's the greatest job on the planet, period. The privilege of performing these delicate operations and helping those in need is unlike any other. This book does an incredible job of relaying those exact sentiments to the public. Kudos to Ted and his team for putting this much-needed piece of literature together. Listen up as we discuss Gray Matters, a biography of brain surgery. Check it out. Hey, Ted, how you doing?
I'm good, Rick. How are you? Good to see you.
Yeah, it's great to see you and very excited to have you on the podcast to discuss your new book, Gray Matters. Fantastic new release, one of the best sellers, and great to hear your impetus for this book, how it started, and really what your vision is for it. So pleasure to talk to you as always.
You know, we go back a long way. You and I both know a lot about brain surgery. You're a perfect interviewer for this. I'm a big fan of what you're doing here. I think it's great. You're kind of bringing the brain surgery perspective to the world, and that's a bit of what I was trying to do as well with the book. So we're aligned philosophically.
Tell us a little bit about what your impetus was to write the book, right? Like, you're busy, you're a neurosurgeon, you're working hard. Now you're going to devote all this time to writing a book. Like, how did the idea come up and how did it motivate you?
So I often give lectures at high schools, let's say, or to lay people, to students, where I'm trying to talk about neurosurgery. And I would always try to find a way to bring people in. How do you bring people into our world? And one of the ways I did that along the way was to kind of talk about cases that people knew, whether it was JFK's assassination, and then you talk about anatomy, or Natasha Richardson falling down, hitting your head, you talk about epidural hematomas, or Michael J. Fox to talk about Parkinson's. And I thought I could use that as a hook in a way to get people interested in learning more about brain surgery by telling stories about people that they knew, celebrities, politicians, sports figures who had brain surgery, but describe their cases from our perspective. How do we see these cases? Because the public sees them one way, but we really know what the importance and the significance of that is. So that was the first germ of the book, but it morphed into so much more than that as I started writing. And I started realizing that I also needed to tell my story a little bit. What was my training like? What is it like to become a neurosurgeon? And then really get into my head when I'm doing a complex operation. What is it like to prepare for a 8-hour, skull-based surgery? What is it like to be under the microscope when you're picking away a brain tumor for hours on end, making multiple decisions that are going to be critically important to someone's life? So I wanted to tell that story as well because it hadn't really been told. And then I realized that the story of neurosurgery, in a way, is a very compelling story from the days of Harvey Cushing in 1905 to the days of brain-computer interfaces, in 2024. Like, how did we get from there to here? So I also wove that story in to kind of bring the public into our world in a way that I didn't think had been done before.
Now let's get into the book, and you talk about some of the most challenging components of being a brain surgeon. And there's really 2 that you talk about, but I want to know which one for you personally has been more difficult. Is it the technical challenge of these procedures, or is it delivering those life-altering news to the family and the patient when it's a malignant tumor and when there is a certain life expectancy?
I think it's both, Rick. I mean, I think that, and they both play off each other so critically because, on the one hand, we have to be practitioners of this skill that we have to master. And it takes years and years and years to become great at what we do. On the other hand, we're doing it on human beings and we're doing it on people. And we have to also be compassionate and sensitive. And it goes back and forth because every time you do something well, you go outside and talk to another human being and say, hey, I just did this operation. Everything's going to be fine. And you get that hug and that positive reinforcement, and it's amazing. But every time you make a mistake or you make a bad judgment or an error, you've hurt another human being's life and you have to deal with that emotion. But that's what drives you to become better at what you do, right? To go back into the cadaver lab, let's say, or practice more, or to take more time or to hone your skills. And I think it's that juxtaposition of the two different things that we do, both being these sort of perfect mechanical technician and sensitive and humble. And it's sort of also the humility and the arrogance that is an interplay that we have to jump back and forth between telling a patient, I got this, I'm going to take care of you. I'm the best person to do this operation for you and you're in great hands. But in our own minds to be humble and say, hey, you know what, I could have done this a little better and I have to do it better next time. And to know that I'm not perfect, because that's how we get better. That's how we improve. So
And,
all that is in there. Yeah.
and you and I discussed how we both agree that this is the best job on the planet. I mean, what you get to do in neurosurgery, the impact you get to have on a daily basis is unlike any other profession. Discuss what it's like to make these life and death decisions. And like you said, you have another human being's future in your hands. And it's not once, it's not twice, it's every single day. And the mental fortitude and the stress and the complex decision making, knowing that you're not going to be right 100% of the time. I mean, what is that like?
Well, as well as anybody that it is a burden. There's a certain sacrifice that we make going into this profession. And I kind of write about, um, people think that it's so hard to match in neurosurgery and become a neurosurgeon. The truth is there aren't that many applicants in neurosurgery. When you look at the numbers, there are very few people who want to do this job because it requires such an enormous amount of sacrifice, not only of your free time, and your personal liberty, but it's so emotionally and psychologically demanding to have to deal with these kinds of life and death stressful situations on a daily basis. And even cases that are routine, as you know, are often can become non-routine very quickly if you become complacent. And there's some operations that we do that are more on the simple side, but we've all had complications in those cases where they've gone bad because maybe we cut a corner, maybe we just were distracted, and you just realize you have to become, you need to acquire the ability of intense focus for that period of time when you're doing the surgery, where you just block out the external world. So it's a burden, but the rewards are enormous, like everything. The more you sacrifice, the more you get. Having people depend on you, having people call you and say, we're in a bind, we need your help, and being able to deliver to someone, in their moment of need. Sorry about that. I turned off my phone, but my
Computer.
desktop is
It's all
running.
good. It's all good.
So being there in someone's deep moment of need, I think, is what I was saying. Is also incredibly rewarding in being able to deliver.
I mean, you touch upon the mental aspect, and I'll tell you, I tell our trainees and our residents and our fellows all the time, yes, it's physically demanding, but the mental component of neurosurgery is what separates the average from the good and the good from the great and the great from the legends. I mean, mentally, you have to be so on point and you have to be able to deal with the stress and the emotional roller coaster. I tell our trainees the same thing that makes neurosurgery the best job on the planet makes it the worst. When you have a bad day, it's really a bad day. And it definitely wears on you, like you said. You also talked about your training and neurosurgery residency which we've both been through, years ago when it was, quite frankly, much harder. How has residency evolved, in your opinion, seeing it from the 90s to 2000s to 2010 to now in the mid 2020s?
It's evolved for the good and the bad. I would say both. Um, I write about, the exhaustion that I felt as a resident, and the negative of that, which I felt was not as much impairing my decision making. So, for example, if you get called at 2 in the morning and a patient's deteriorating, you have to order a CAT scan on them. You can do that. What I found more challenging at 2 in the morning was if someone's IV fell out and I had to go put in an IV at 2 in the morning, and doing a procedure on someone who obviously was more upset and in more pain on the other end of that needle than I was. Being sympathetic to them and sensitive to them when you're exhausted and just want to go to sleep is very challenging. There's no question that we probably worked a little too hard, and it was detrimental to our health. And you can only learn so much when you're exhausted. On the other hand, although neurosurgical training has to become a little gentler, it can't become less rigorous, right? It can't become gentler at the expense of teaching someone that, hey, this has to be the number 1 through 10 priority on your list if you're becoming a neurosurgeon. This can't be like number 3 on your list. And because of that, you have to learn how to sacrifice, and you have to learn how to take on a new role, and kind of give up that prior self that you were before. I think we were all very probably selfish during our high school and college years when we were doing well on all our tests and we just wanted to get our A's, we wanted to get our pats on the head. And then suddenly you start working no longer for yourself, but for other people, and putting your own interests, in the back seat. I think that's very challenging psychologically for an overachiever who becomes a brain surgeon. So I think the training, is having a hard time right now finding that perfect balance between, yes, we have to take care of people's psychological, emotional health better than we did in the past, for sure. But we can't compromise the fact that they have to learn an enormous amount of information. They're only going to be exposed to a certain number of operations. Some of those operations are going to happen at 2 in the morning and after 12 hours, and you have to decide, is this worth doing or is it not worth doing? And we're kind of in a transition period. I think you're more involved in your residency program than I am per se. So I would even ask you if what your thoughts are on that.
Yeah, I mean, I think about this all the time, and I agree with you that it shouldn't have been as brutal as it was back when you and I did it. I think, look, I mean, you and I came out great, and I feel like it definitely made me a better surgeon. It made me better prepared to deal with the psychological roller coaster of neurosurgery, right? It's not like you're working 9 to 5, you're not working behind a counter. Like you need to be mentally and physically very strong to be a neurosurgeon. So I think it made us better. At the same time, it was too rigorous. I certainly agree with you. I guess the question is, are we too soft on our neurosurgery residents right now? And I honestly don't know the answer to that. I think that a lot of these regulations try to protect the trainees, and that's a great idea and it's motivating, but I think at the same time we're actually hurting our trainees because you're putting so many restrictions and you're protecting them from this quote unquote outside world, and then they get to the outside world and yeah, there is no 80-hour work week, and yeah, you're going to be on call, and yeah, you're going to operate overnight and have clinic the next day or surgery. So I don't know. I actually don't know what the right answer is. I think it's a happy medium. I'm just worried the pendulum is swinging too much in the other direction, and we're creating a generation of neurosurgeons that may not be able to handle the rigors.
It's hard to say, but I would say this, and I think you probably agree, that people, our residents, the ones who go into neurosurgery, they're pretty darn committed. You know what I mean? Like they want to stay later. If we say you have to go home, they don't really want to go home. They want to stay. They want to do the extra case. They want to learn more. I don't get a sense that they are sort of lazier Gen Z or Gen X, whatever it is. So I think they will rise to the occasion when called upon because just of their character.
Yeah, and that's what I'm hoping for. And like you said, I think the generations that are coming up have that component of laziness, but I think neurosurgery weeds that out essentially on day one. So you also talk a lot about the era of technology and how your techniques and equipment have advanced over the generations which you've been working. Tell us a little bit about what was your biggest pioneering move? What was your biggest advancement and what you went through in order to make that happen?
So I talk about the development of minimally invasive neurosurgery, really skull-based surgery, which was a concept that didn't exist, certainly when I did my training. And I was one of the first people to adopt the ability to operate through the nostrils using endoscopes, not just to take out pituitary tumors, which are fairly small tumors that are easy to access through the nose, but to really use that trajectory to go into the brain and take out more complex brain tumors that otherwise would require and had required, and in some people's hands still do require, an opening on the side of the head where you dismantle the skull and take down the muscles and move the brain aside to try to get there, which we can now get to through essentially no incision whatsoever. I was very fortunate to have a collaborator named Vijay Anand, who's an ENT surgeon. And we started doing these cases first just to take out pituitary tumors. And then it quickly became apparent that we could use this technique to do so much more than what we thought. And as we started to do it, there was an enormous amount of resistance among the more senior neurosurgical intelligentsia, the powers that be, not only in my own department and in other departments in New York, but all around the country and all around the world, really. And so that became very emotionally challenging to be performing an operation that you knew was better and that you knew you would get better results in the long run, but to have people who you look up to, right, who are the professors who taught you, and the more senior people in your field tell you that, hey, maybe you shouldn't be doing this. This might be irresponsible. And over time, however, it became apparent that what we were doing really was better, and now everybody's doing it. But for that period of time, and that was a period of a good 10, 15 years, that was another emotional challenge that you had to deal with, convincing people that you respected highly that the way they were doing it may not be the best way to do it. And then there's this sense of like, who are you to be reinventing neurosurgery? But the truth is, every neurosurgeon reinvents neurosurgery to some extent in their own operating room. And that's the way the field advances. And then, as I was doing more and more of this endonasal surgery and getting invited around the world to speak about it, I went to South Korea to speak about endonasal surgery. And just like, the endonasal surgery was really done mostly in Italy in the beginning, and I had to go to Italy to learn it. This is one country where everybody started doing it. I went to South Korea, and they were doing this transorbital approach, where they were making a small incision in the eyelid and taking out skull-based tumors working around the eye, which just seemed crazy to me that there'd be enough room between the bone under your eyebrow and the actual orbit of your eye to go in and take out a tumor. But I saw what they were doing, and I was amazed. And I realized that we needed to start doing this in the United States. So I very quickly began a program and began collaborating with oculoplastic surgeons to try to do this. And that still meets with resistance now. I'm facing the same thing, but having gone through it once, I'm definitely much better equipped to go through it the second time. And the other thing that is so important when doing new approaches is not to overstep, because the problems arose for some of the approaches we did originally when people would try to do too much. They would say, well, every tumor should be come out this way. And then you start getting complications, and then you don't really have a leg to stand on. So the most important thing in doing new approaches is selecting the right case for that approach and not trying to bite off more than you can chew, and just being very careful and cautious and methodical in choosing the right operations to do. So that's held me in good stead, because I really haven't tried to do things that are too aggressive or too excessive, and just sort of stay right within the center lane to get the job done, to make sure that my patients have great outcomes, because that's really the goal.
Yeah, I mean, I was in New York at the time training back when you were pushing that field forward, and I frankly learned my endoscopic skills from watching you and VJ do it. So I obviously owe you a lot. But I think the take home point there is the self-confidence to know that what you're doing is right. Even if other people that you respect are saying no, or they're questioning you, knowing that what you're doing is the right way to do it, it's the better way to do it, and the confidence to keep pushing, collect the data, and then make it standard of care. Obviously, something I learned from you watching in a very close proximity, how you dealt with that, and then ultimately you became the pioneer in that field, which is now standard of care. So obviously, kudos to you and your team. Let's talk a little bit about
Can
brain
I just
computer.
say one thing? The key to
Sure.
that, though, was to have an equal dose of humility, because you have to say, you know, it's not perfect. We have to make it better. We have to make it better. We have to make it better, and to not be overly arrogant, because we both know there were some surgeons doing it who probably were overly arrogant, and it did not propel their careers in the same way as if they had had a little more humility and said, you know what, this is great, but we're going to keep working on it to make it better, and we can't do it for everybody, et cetera. So I just want to throw that in there.
For sure. And there's nothing more humbling than neurosurgery, because no matter
Yeah.
how good you think you are, you think you're on a good roll, and bam, you just, it really knocks you back. So, absolutely, you have to be humble as a neurosurgeon. You really have no choice because it'll happen to everyone. But let's talk about brain computer interfaces like Neuralink. And this is going to be what looks like the next stage of human evolution, but there's major challenges. Tell our listeners, how do these BCIs work?
So, a brain computer interface is basically a computer chip that gets implanted in the brain that can read the neurons, the brain waves activities. And there are different techniques for doing that. But essentially, it takes the information out of the brain, puts it into a computer, and then the computer can interpret those brain signals and then translate that into some sort of behavior or movement. And that movement could be moving a computer cursor screen and, you know, surfing the internet. It could be moving a robotic arm. It could be driving a car. There's an enormous number of things you can do once you can get information out of the brain. And in another sense, you can also get information into the brain. You know, there's the concept of creating a visual prosthetic that has been around for some 70 years. People have been trying to restore vision to the blind by putting computer cameras on glasses and sending the information to a computer and then stimulating the part of the brain that processes vision to create flashes of light called phosphenes. So there's a long history of these brain-computer interfaces. People just know about it now because of Elon Musk and Neuralink. But in 1962, a neurosurgeon named Tracy Putnam at the Neurological Institute, who was at the Neurological Institute and then was in California, created the first brain-computer interface to restore vision with a handheld photoreceptor in a blind person's hand that would be translated into electrodes that were put in the brain. So these things have been around for a long time.
I mean, it's exciting and it's also incredibly scary when you think about where it's going, and it almost seems like a science fiction movie because it is. And the ethics behind it are even more complicated than the technology, and that's a whole nother podcast. Um, let's get into CTE because that's really taken a lot of mainstream media ever since it was discovered. I believe it was 2004, five, something like that. But really has become such a centerpiece in sports, especially with the NFL. Tell us a little bit, what is CTE? How does it impact the brain? And how are neurosurgeons involved in this disease?
So CTE stands for chronic traumatic encephalopathy, and it's a disease of the brain that results from multiple impacts to the brain or pressure waves going through the brain. And there are multiple ways that can happen. It can happen in boxers, it can happen in football players and soccer players. We're now learning that blast injuries in the military, even if you're standing next to mortar shells that are going off, are sufficient to damage the brain. The brain is very sensitive organ, and even though it's housed in a hard shell, when you give enough impact to it, even if it doesn't cause any symptoms, and those are repetitive and occur over time, you can really damage the brain over time. And the story I try to tell in the book is a story from a different angle, right? We all have heard the story. We saw the movie with Will Smith about concussion, and we kind of know that there's this thing, CTE. But the whole story played out on the pages of one of our journals in neurosurgery, where the NFL started to publish these articles trying to convince the public, really the scientific public, that football was not a problem, that concussions were not a problem. And they were reviewed by neurosurgeon reviewers. And those neurosurgeon reviewers would look at these articles and say, this is BS. Like, these are poorly done studies. This is not good data. And what you're trying to say here is not really valid and justified. And most people don't realize that the whole story basically played out in one of our journals. And I kind of tell that story over time. I think we're at a point now where people know in the NFL, right? The guys know that there is a risk. They get paid handsomely to take that risk. Certainly, before they knew there was a risk, it was problematic, but nobody knew there was a risk. But I think now, um, as long as they know what the risk is, and they're willing to take the risk, then um, football should still exist. Like, it's a beautiful, elegant sport that if people want to put their bodies at risk to do things, just like there are jobs like window washers or airline pilots where they put themselves at risk for their job, football should be similar, as long as you're aware of what those risks are.
Now those are adults. Should parents let their kids play football? Super controversial.
Right. So that's a great question. My feeling on this is that um, in high school football, the intensity of the impacts and the number of the impacts that occur are small compared to college and professional football. So the chances of someone developing CTE from just playing high school football are extremely small. I played high school football. I got an enormous amount out of it, right? Because you have to balance that with what do you gain by being on a team sport and learning to rely on other people and learning to, go to practice every day and, be physical and challenge yourself. So what I got out of high school football far outweighed the small risk of CTE. That said, there is something else called second impact syndrome, which is another problem that's much more severe. And the adolescent brain is very full. There's not a lot of room in there because the adolescent brain has a lot of neurons that we lose over time. And there are some kids, a couple kids every year who will have hard impacts and then sometimes have a second impact, and their brains will start to swell uncontrollably and they will die from those impacts. But that is different than um, uh, chronic concussions and CTE. And it's obviously something that we need to work on to try to make safer. Ironically, I learned when I was researching this that more high school kids die of dehydration in practices than die hitting their heads during football games. So there's a lot of work we need to do to make kids sports safer for our kids, so they're just fun for them, and there is a bit of challenge and risk, but it's really not excessive. But the decision to play college and professional football is a completely different decision, because at that stage you're really taking much bigger hits and many more of them, and that can potentially do long-term damage.
I couldn't agree more. I played college football. I played high school football, and the benefits far outweigh the risks, in my opinion. Just like you said, being on the team, the practices, the physicality, the discipline, to me, far outweigh any risks of head injury at that level. But yeah, college and pros, very, very different. Um, you've had an amazing career. You're obviously a legend in the field, and you're one of my biggest mentors. And now you're a best-selling author. Just wondering what the next challenge is for Ted Schwartz.
I really love writing, to be honest with you. I love expressing myself on the page. I have written a lot of articles over the years, as you have as well. And I really enjoy the process of writing. So I would love to continue to write. We'll see how the book does. If people want to hear more of my voice on the written page, to me, that would be a thrill, to write short articles, long articles. Oliver Sacks was one of my heroes when I was in college. I majored in philosophy and English, and I read everything that Oliver Sacks wrote, and probably that's what made me get interested in medicine and neuroscience, and ultimately neurosurgery. And there are some great neurosurgeon writers out there who are wonderful writers, and I've loved reading their books. And to the extent that I can write more would be terrific.
Now, what would you tell any of our listeners? Let's say there's a kid out there that wants to be the next Ted Schwartz, wants to know what the next step is. How do they do that?
You mean to become a neurosurgeon?
No, the next Ted Schwartz. A neurosurgeon, a writer, a pioneer.
I would say they should not be the next Ted Schwartz. They should be who they were meant to be, because we all are different and have different abilities and desires and drives. And so, whatever their name is, they should be the next that person and just actualize whatever their dreams are. I think the most important thing is just to believe in yourself and what you're doing, and just to keep doing it, even when you're facing adversity and bad days and strong headwinds, to just keep your head down and not get discouraged. I see it in my own kids, of course, will run into adversity, and they think it was always easy for me. based on my education and what I do and the respect I get for what I do. One of the things I did, Rick, when I wrote this book, because I wrote this book, obviously it was out of left field. It's not what I do. And I realized the way you sell a book is you have to get an agent, and then the agent has to sell it to a publishing house. I just wrote a book and I sent it out to about 15 agents, and I got rejection after rejection after rejection. And every time I got a rejection, I would send a text to my kids. Just got rejected again. Just got another no. This person doesn't have time for me. This person doesn't think this will be successful, because I wanted them to know that it wasn't easy, that I was struggling. And I had to overcome this adversity and push ahead. And then I got a yes. So there was something to celebrate. And obviously, a couple of years later, there's a book out there, but it wasn't always easy along the way. It took a lot of work and perseverance.
Ted, listen, what a phenomenal interview. Obviously, this podcast means a lot to me because I've known you for so long. You've been such a role model for me. And I think a lot of the lessons in your book, for all our listeners, if they didn't hear it, Gray Matters by Ted Schwartz, phenomenal book. Everything that you personify as a neurosurgeon, as a pioneer, getting through the difficult times, understanding why it is the best job on the planet. I think your book is tremendous, and I'm excited to see what your next edition will be.
Well, thanks, Rick. I'm a huge fan of yours, as you know. I always tell people, you were doing a fellowship across the street at MSK, and you would come to my OR and watch me operate because you wanted to learn more. You wrote more papers with me as a not even my fellow. You were a fellow across the street. You wrote more papers that year than any fellow has ever written with me because of your incredible motivation and drive. And it is remarkable what you have done and what you will do and what you are doing. So kudos to you, Rick.
Awesome, Ted. Listen, I'm going to let you get to your clinic. Thanks for making time for us. And again, amazing book. Congrats on everything you've accomplished.
Thanks so much, buddy. Take care.
Take it easy.